late at this moment, but good morning to all of you who have joined. Grateful you're here. I want to just quickly move on through, instead of doing self-introductions, although it's not a massive crowd, because of the content and the time, and we don't want anybody jumping off because your clock has expired. We want to get to the meat of our morning. So with that, I want to welcome you again. My name is Frank Jones. I'm a partner at the Maintenance Insurance Agency and co-chair of the Healthcare Committee. Used to be co-chair of Government Affairs, along with Kendry McWilliams, who's the CEO of Maryville Addiction Treatment Centers. And we'll get more into Kendria later. But first, our first speaker, we're thrilled to have this morning. She joined Senator Walter Rand Institute back on the date of love, 2/14/22. So Valentine's Day, she joined Senator Walter Rand Institute for Public Affairs, and we're thrilled to have Mavis Sayadu Frimpong. Very, very bright, very, very nice woman who we had some time this morning to catch up with. My first time to talk with her and see her, and thrilled to have you, Mavis. Thank you very much. By rights of introduction, I think it's apropos that this entire introduction be read, and so give me just a moment. Mavis is the director of Senator Walter Rand Institute of Public Affairs, where she holds responsibility for the vision, the values, and the strategy, and collaborates with WRI leadership and designates of the Rutgers Camden campus to operationalize the vision. Before joining WRI, she was Director of Strategic Initiatives at the University of Pennsylvania's Leonard Davis Institute of Health Economics. For those in the know, it's Penn LDI, where she facilitated and supported the development of impactful academic research partnerships with a variety of external partners, including foundations, health departments, and payers. It's a vast mix of people there. In the past, she also served as Director of National Initiatives and Communications, Content Development at the Camden Coalition of Healthcare Providers, and where she directed programs, projects, and strategic communications to support the emerging field of complex care, and was the Assistant Director of Policy and Planning at the San Francisco Department of Public Health. Yes, I'm wondering the same thing. What made her move out here? Not sure. Where she led a variety of health policy and community engagement initiatives on behalf of the city and county. She holds a BA from Brown University, an MPH from Johns Hopkins Bloomberg School of Public Health, and a JD from Stanford Law School. So when I say we are privileged to have Mavis this morning, that's not an understatement or an overstatement. We are thrilled to have you, Mavis, and I will now turn it over to you.
Thank you so much, Frank, and good morning, everyone. And thank you to this committee and to the larger Southern New Jersey Development Council. The Senator Walter Rand Institute is a member, and I have, since I came to WRI, I've just been so impressed with the information that comes out of the council, and the newsletters are great, and the information that you share is wonderful. So I was really thrilled and honored to have been asked to come and speak today.
I wonder if you could
thank
check
you
on it. He's very
so
anxious.
much for having me. As Frank mentioned, my background kind of stems
Edward
policy
Scull, S-C-U-L-L.
from the San Francisco Health Department through to, community provider world, from the Camden Coalition of Healthcare Providers to research. And the Institute really marries all three of those things. So it's been a really great experience. I've been in the position about 8 months, and it's been great to really focus on such a wonderful area of the state where there's a lot of need, but also a lot of opportunity. And just to answer the question that must be burning in everyone's minds, I left the Bay Area because I'm from New York City. So I'm an East Coast person at heart. And so my family and I wanted to come back and start to build roots here. So next slide, please. So there will be three main parts to this presentation. I know you're probably all familiar with WRI, but I think it's always good to do a little bit of level setting. So I'll talk a little bit about the Walter Rand Institute, who we are, what we do. I'll talk about the current projects that we have in the public health and healthcare space, and then also give you a little bit of a sneak peek onto future projects on the horizon that, of course, if anyone is interested in learning more about those, we could also talk offline as well. Next slide, please. So the Senator Walter Rand Institute for Public Affairs sits within Rutgers-Camden, and it really exists for two main reasons. The first reason that the Walter Rand Institute exists is to conduct community-focused, community-informed, community-facing, community-engaged research that connects to public policy and practice issues in Southern New Jersey. So we focus almost exclusively on Southern New Jersey. Some of our projects, one of which I'll talk about today, focuses on the state more broadly, but most of our projects focus on Southern New Jersey, which, as I'll go into a little bit more, is really needed in our state. There really is a need, as you all know, for a focus to be on Southern New Jersey when we think about developing sound policy and practice. So WRI can kind of think of it as the place where community-focused research, policy, and practice kind of intersect in South Jersey. And another thing that I wanted to mention is that the research that we do doesn't really have a content area of expertise. We don't focus only on health or only on XYZ, and that's by design. Southern New Jersey is such a diverse set of counties with a diverse set of interests and priorities and issues and challenges. Our urban locations to our coastal counties to our more rural areas as well. There are a lot of issues that fall within the 7-8 Southern New Jersey counties. And so it's important for an institute like ours that focuses on Southern New Jersey to be able to be nimble to apply our methodology to all different kinds of areas. And so we have projects in health, we have projects in workforce development. I'm hoping you all saw our most recent report that we put out, Seeking Work in Southern New Jersey, that highlighted the barriers and opportunities in maintaining a healthy workforce and economic opportunities for the labor market across our region. So that's one example of the kind of work that we do. And we really also focus a lot on qualitative research as well. So I think a lot of people are familiar with quantitative research, right? The numbers, the statistics and the data, and that's hugely important. But qualitative research, right, where you are conducting interviews and focus groups is also really key, because oftentimes the stories, the narratives, the actual who, what, where, when, and why behind the numbers is just as important as the numbers when you're trying to develop policy. And as someone who's sat in policy practice and in research, I'm a real proponent of qualitative information, because that nuanced, specific kind of comments that people have about what's working and what's not is often what's missing from the conversation when we're thinking about policy and practice. Next slide, please. So as you'll see from this presentation, WRI, because we are externally facing and Southern New Jersey facing, it's really important for us to be highly collaborative. And so we work with community partners, foundations, government agencies, community-based organizations, and service providers, legislators to conduct research around the issues of the day and the issues of concern in Southern New Jersey. And we're obviously also an academic institution. So we have academic partners as well, an advisory board that helps us really keep our ears to the ground on what kinds of issues are really bubbling up to the surface for Southern New Jersey residents. And then we also engage a lot with students as well and see ourselves as a training ground for the next generation of social sciences researchers. Next slide. So the first project I'm going to talk about today is the community health needs assessments that we have done over the past few years. As you all know, community health needs assessments is a requirement for nonprofit hospitals. And for us and the health systems that we work with, we see these CHNAs are not just, a check mark, something that has to be done where the report kind of sits on a shelf and there's no connection between the report and what actually happens on the ground. We see the community health needs assessments as really blueprints for action. They are roadmaps and pathways to opportunities and to the challenges that people are facing and to the ways in which we can address those challenges. And so over the past few years, we have worked with a variety of different health systems, as you've seen on the screen. And most recently, we have worked with Inspira. to conduct a community health needs assessment across 3 counties, Salem, Gloucester, and Cumberland. And as you'll see, this information is not only relevant for Inspira, right, and the communities that they serve, but also healthcare providers, public health folks across the southern New Jersey region, and anyone that is thinking about what the health issues are in our region and how to solve them. And so it's a great window into what the community is facing and how we can address those challenges. And Inspira has been a really great partner, and they are really a forward-thinking entity that it has been a great pleasure to work with them on this. So just to give some context around health outcomes in South Jersey, I talk to people a lot who don't always know this, not in southern New Jersey, mostly elsewhere across the state. But as you can see from this data in terms of health outcomes, as we're defining them as length and quality of life, almost every except for one, southern New Jersey County consistently ranks in the bottom half. When you think about across the 21 counties in New Jersey, health outcomes rankings. And this report is going to focus on Cumberland, Gloucester, and Salem. And as you can see, Cumberland, Gloucester, Salem, Atlantic, Camden, they sort of trade places in terms of 18, 19, 20, and 21 consistently year after year. And that represents a lot of different challenges. It represents everything under the sun, housing, transportation, food insecurity, access to healthcare. So the Walter Rand Institute is a really special, I think, resource because we focus on southern New Jersey when we're thinking about research that's going to highlight the concerns and needs and challenges that South Jersey residents are facing. And this is clear evidence that there needs to be more attention placed on our region because these health outcomes are speaking to all of the other social determinants of health and all of the different issues that we're all working on here today. Next slide, please. So very briefly, in terms of methodology, surveys, interviews, focus groups with community members, community providers, residents, and healthcare personnel, and also secondary data analysis to really help to illuminate and provide a fuller picture of the issues and a more well-rounded perspective of what the communities are facing in these 3 counties in southern New Jersey. Next slide. So this slide provides a little bit more of the county context and the secondary data that we looked at. So as we all know, in terms of, rural counties, Salem and Cumberland really leading the charge in terms of, rural land within that county. Transportation is a huge challenge, as we all know, across southern New Jersey, and particularly as we see here in Cumberland and Salem. Higher than average distances to the grocery store, particularly striking in Salem County, which will be illuminated in my presentation today. And then much higher averages, as you can see toward the bottom, in terms of, ratio of population to PCPs and mental health providers, which we'll also touch on in this presentation as well. Next slide. So the first thing that I'll talk about is the survey data. So I encourage anyone who's interested to really dig into the report, which I provided a link to. But the survey data, the community survey data that we looked into, asked people to think about what the barriers that keep people in their community from accessing care would be when they need it. And we analyzed the data and sort of ranked it by percentages of people who noted one issue or 2 issues or 3 issues to be the top for their community. And as you can see, across each county, Cumberland, Salem, and Gloucester, out-of-pocket costs were the top concern that people raised. On average, if you put the 3 counties together, 71% of respondents shared that they couldn't afford out-of-pocket costs, such as copays and prescriptions. And this connects to, a little bit of a curious result, because only 2% of people who took the survey said they were actually uninsured. And, in terms of health insurance coverage, it's not astronomical in terms of uninsurance rates across these counties. For New Jersey, the average uninsurance rate is 9%. Gloucester, Salem, and Cumberland hover between 6 and 13%, uninsurance rate. So it's not, obviously it's high for Salem and Cumberland and 8% and 12.8 higher than the national and the New Jersey average, but it is a little bit curious to see people really not being able to afford those out-of-pocket costs, yet most people being insured. And then you'll see also that lack of insurance coverage was relatively high as well. And so I think there's a need for kind of further research into how that's actually playing out for people, where technically there isn't an insurance coverage problem, but people are raising that as an issue for them. Transportation will come up again and again in this presentation, particularly in Salem and Cumberland County, as you can see on the slide, as a real barrier to access to care across the 3 counties. And then you'll also note, trust in providers and confusing systems of care also being barriers for people as they are trying to maintain and get access to healthcare and healthcare services across the 3 counties. Slide 10, please. And this slide notes community health issues. And the question here was, which of the following are health issues in your community? So the first one were, what are the barriers? This one was about, what are the health issues in your community? And as you can see, mental health was the top issue across all counties. It is something that came up again and again in the surveys and also in the more qualitative research that I'll talk about today. And we also saw, adult overweight and obesity being high up on the list across the counties, illegal drug use, substance use disorder also being high on the list as well. Next slide. So in terms of the qualitative findings, the interviews and focus groups with community providers, residents, and healthcare personnel, as you can imagine, COVID-19 was one of the, top issues that people said had a real impact on their health. That shouldn't be surprising to anyone, particularly folks in this healthcare committee of the Southern New Jersey Development Council. So I won't, go into this as much because I'm sure you're all acutely aware of this in terms of, the impact that the pandemic had on all areas of daily life, people being forced to exit the labor force because of layoffs and childcare needs, employers sharing that they had problems with accessing, relief funds and programs that were meant to help them stay in business. The Paycheck Protection Program and some of those other programs that businesses and employers thought they could take advantage of, but just didn't have the opportunity to access. Social services and healthcare agencies discussing ways that they had to adapt to the ever-evolving guidance around COVID-19 and how to stay safe, how their employees, could stay safe, and how the people that were accessing care could stay safe as well. Mental health as a top priority for residents. There was a sense that, there's a lot of demand without, enough access to services. And, when you think about rural counties and just generally transportation being an access problem, where people are just not able to make it to appointments or to, make it to multiple appointments. They can make it to the first one, but not to the next few, things like that. Really factoring into the issues that communities are facing. Substance use disorder and illegal drug use came up high in the survey. And as we all know, COVID impacted this as well. And I just want to read one quote from someone in Salem County who noted that, we have more access to liquor stores than mental health treatment in our neighborhood. And that was something that, showed up as people were talking about what they wish they had, which was, more access to mental health services and substance use disorder services in their own communities. Access, affordability, and availability of services, transportation being the real hot button issue here. Residents were concerned not only about public transportation and how to get to appointments, but also, NEMT as well, logistic care and access link, and how to ensure that folks have access to those services for non-emergent, medical transportation as well. This was really acute in Cumberland County. 81% of Cumberland County residents drive to work every day, which is 10% higher than the state average. Cumberland County residents were twice as likely as Gloucester County to name transportation as a barrier, and more likely to see public transportation as a much needed health resource that's missing in their communities. The last thing I'll say here is that there emerged kind of a need for, translation and Spanish-speaking healthcare services and providers. And there was a sentiment that the information that was provided, the translation services, were somewhat inadequate for Spanish-speaking populations. And so thinking about that as well. Next slide. So access to children's health care was something that came up over and over again. People in the communities and community providers were really shining a light on this particular issue. And the same issues for adults were showing up here: transportation challenges, not enough providers, pediatric providers, obstacles to accessing specialty care. 20% of residents across the counties reported that, children and youth were underserved members of their community, and 33% said that pediatric service providers were a resource that was missing in their community. So this was something that we wanted to pull out from access to care as something that folks really felt needed to be addressed immediately within their communities. And then lastly, food and diet. I will touch on mostly food insecurity being one issue that came up over and over again in our work. 1 in 5 survey respondents in Cumberland and Salem worried about running out of food, and that number was 1 in 10 in Gloucester. So a huge issue across the 3 counties and across South Jersey more broadly as well. Access to food, just being a thing that came up on the community provider side and on the resident side as well. One thing that came up that struck me in the information was, people really appreciated the partnerships between food pantries and food banks in these areas. Right? But there was a concern about undocumented folks not being able to access those services or access that opportunity because of fear of having to provide personal or identifying information. And so that undocumented community could be left out of the resources that are already scarce in these places where food insecurity was a real challenge. Next slide. We also looked at emergency department data across all of Inspira's EDs. And, while this is sort of specific to the Inspira health system, I think it provides a window into how people are accessing the emergency department and who's accessing the emergency department and what those experiences are like. And so I'll briefly touch on this, where, across the EDs in Vineland, Woodbury, Elmer, Bridgeton, and Mullica Hill, there were almost 200,000 people accessing the emergency department between 2018 and 2020. And as we can see, we sort of outlined low, high, and super utilizers. And as you might expect, most visits were, low utilizers, but the high and super utilizers accounted for over a quarter of visits over the analysis period. Most of the high and super utilizers were likely to be female or identify as female. And, most of them were privately insured as well. More than half of the visits came from Cumberland County, 53%. And interestingly enough, even though Camden County wasn't one of the service counties that we looked at, Camden County residents visited the Inspira ED similar to Salem County residents. And so people were coming from Camden County into Inspira's EDs. And so that's something I think to also look at as well, what the reason is for that and why that would be and what people are experiencing that would make them want to travel out of their county to access services. So this kind of concludes the high-level overview of the community health needs assessment, and I've put a link to the community health needs assessment there for anyone who's interested in learning more about what we found. Next slide, please. The next project that I'll touch on is what's called Community Conversations. And this was a partnership with the YMCA State Alliance, the New Jersey Department of Health, where WRI analyzed almost 600 submissions from all across the state. And the question there was, what impact did the pandemic have on you? And though this wasn't South Jersey focused, it was New Jersey focused, which we sometimes do. I think it provides a window into the community perspectives of what the impact of the pandemic had. And so I'll briefly touch on some of those themes. Next slide, please. This kind of notes a little bit more about the research questions and what the purpose was. And I'll just say that the submissions came in all different forms. There were drawings, poems, interviews, focus groups done, people shared songs, however ways they wanted to communicate their experience, we were able to creatively analyze those and come up with themes. Next slide. So there was lots to unpack. I really encourage anyone who's interested to take a look at the report. But as you know, I'm sure this is not surprising to anyone, but I think one of the most important things about research is to bring to light what might seem self-evident, right? We've all heard stories anecdotally about what the impact of the pandemic was, but it's good to have evidence behind that so that we can prioritize the needs and prioritize the solutions according to what the community's perspectives were and not assumptions about what the community's perspectives were. So the kind of research that this is and that the findings illuminate are really important, and the state, the Department of Health, is relying on this to develop, community health improvement plans, and Healthy New Jersey 2030 is relying on this information, which I think is really key and much of the reason why WRI exists. So mental health, social factors, access to care, housing, reduced transportation, and the impact that had on folks all kind of came up as themes in terms of what the biggest challenges people faced during the pandemic. One thing that I want to pull out that I haven't talked about yet is the digital divide. And so people not being familiar with technology or not having access to the kind of technology that made life a little bit easier for folks during the pandemic, that was one of the things that came up over and over again in the research. And then housing as well, particularly for people who are unhoused or experiencing homelessness, and what the impact of guidance that says stay home has on people who are not able to do that, and for all the different reasons that we all know are challenges for people who are experiencing homelessness. And then just the general increase in mental health demand that the pandemic both highlighted, but then also exacerbated in terms of social isolation and increased anxiety and depression, and just negative mental health outcomes more generally. And then in terms of overarching themes that cut across all of these, so isolation and trauma, stress, grief, anxiety, what the pandemic has done in terms of impact on emotional well-being, and then inequalities and disparities. The pandemic brought to light lots of inequalities in our systems, where the disproportionate impact on Black and Brown communities across, the country, across Southern New Jersey, across New Jersey, highlighted the need to really bring momentum to bear on creating systems that are equitable, not only in terms of race, but in terms of socioeconomic status as well. And then unpredictability now into the future. I think we're still trying to figure out and understand what the post-pandemic environment looks like, what it should look like, what lessons we've learned that we want to carry forward in terms of policy and practice into the future, and what changes we want to make and how to prioritize those. Next slide. The next project I'm going to talk about is the overdose fatality review team work that WRI does. So the data and information is sort of shared by the overdose fatality review teams. And so I'm not able to share that today, but I wanted everyone to be aware that WRI serves as the data and research partner for Burlington and Cumberland counties overdose fatality review teams. And, I'm sure you'll maybe talk about this in the next session, but OFRTs across the counties analyze trends, they identify, strategic opportunities for addressing substance use disorder and overdose deaths across the country. Oh, sorry, across the state and across Southern New Jersey, depending on which county you're looking at. But, the work that WRI does supports OFRTs in really understanding the data, interpreting it so that they can make sound decisions about what kind of priorities should be made in terms of addressing overdose deaths in the county and ultimately across the state. Next slide. So in terms of the future and what's next, so I want to make sure everyone, to the extent that you're interested, keeps an eye on the projects that we have that are upcoming. So another CHNA community health needs assessment will be forthcoming, where we're working with Atlantic Care to focus on Atlantic County as well. So, across the Salem, Cumberland, Gloucester, and Atlantic County, we will have done a community health needs assessment for, over 800,000 residents, across Southern New Jersey. So it's a real window into the community perspective.
Chris, how are you today?
And
my client here?
health care and public
Okay,
health
speeding.
priorities for Southern New
All
Jersey.
over this morning for some reason. I guess because it's the
We
rush hour time
also
that came down.
have and will continue our ongoing OFRT partnerships as well. Note that we'll be coming out with a report for our Screen NJ project, where we evaluated the impact of lung cancer screening protocols. And we found some really interesting results that have implications for sort of upstream prevention measures and addressing chronic illness in our communities. And then finally, Southern New Jersey has an Institute for Population Health, and we are likely going to engage in a project that helps to illuminate, social determinants of health needs, barriers, challenges, and recommendations across Southern New Jersey counties, particularly our rural counties, where, as we know, social services, healthcare, and public health delivery is a challenge. We haven't cracked that nut. And so there needs to be more research into the who, what, where, when, and why around that. And so we'll be looking into that. And we'll also be, obviously producing research in other areas outside of healthcare as well. So I would welcome further conversation about this, but WRI is doing a lot of interesting things in this space. And the research that we're working on, we're really wanting to have, community significance, public policy significance, community provider significance as well. And so I'm hoping that this presentation was illuminating and provided some helpful information to everyone on this committee. And I thank you again for having me.
Mavis, thank you very much. I think this presentation should probably be done as often as you can do it and as quick as you can do it to many organizations. It's very, very helpful. I have had the experience of working with the Walter Rand Institute on a specific small project, but to see the depth of work and the broad reach that is really being done is very, very helpful and wonderful. Put together. Just somebody simple like me could just read the presentation, think I have enough information to go on and have discussions, but it's very, very helpful. Thank you very, very much.
No problem. Thanks again for having me.
At this time, I just want to open up to the committee for any questions that you might have for Mavis. And really no questions are off the table. I'll just give a minute. If you want to just raise your hand or start to speak, that would be wonderful.
I have a question, Mavis. It's Donna from DeBoer Heart and Lung Center. The food security issue that you touched on the CHNA, great presentation, by the way. We are seeing this in real time now without a data lag. It seems to have exploded with this inflationary times we're in, and public resources are not matching that. So I'm not sure the data that you have that you've been working with, what the time lag is, but has that been factored in? Because it's just so much food insecurity right now that we're being assailed with.
Absolutely, yeah. And the CHNA is sort of meant to capture information like you're saying in real time, because Inspira and other community providers and health systems have to create implementation plans based on the community health needs assessments. And so we were collecting data during the pandemic, where I think we first saw the explosion of food insecurity. And one of the things that we are seeing, right, is food insecurity exploding because not only did it exacerbate the food insecurity needs for people that already had them, but it created food insecurity needs for people that didn't before the pandemic, because of the people having to leave the labor force, people losing their jobs, people not being sure how many hours they were going to work the next week. And so the proliferation of food insecurity has implications for the workforce development challenges that we're facing, housing, transportation, all of those things. So the data that we have is very current. We were collecting it during the pandemic, and we also are seeing that food insecurity was a challenge even before the pandemic. But I think the pandemic really highlighted this challenge, and we haven't seen, as we have seen in some of the other institutions, where the needs sort of not stabilized, right? But there were intense needs at the beginning of the pandemic that we were able to sort of address, in housing and some of these other issues. Food insecurity is one that is persisting, in the post-pandemic world. And I think that shining a light on, food insecurity, and particularly in our rural counties where we just don't have enough resources for people that need it is really critical. So to answer your question, yes, real-time information, that's kind of why WRI exists, to be able to provide real-time information for policymakers and community providers to rely on. And we're seeing, that what you're saying in multiple projects, not just in the CHNAs, but we have other projects as well where we're seeing food insecurity come up over and over again as a really urgent, unmet need. I hope that made sense.
Any other questions before we move on? Okay. Mavis, have you ever read the book Start With Why by Simon Sinek?
No, I haven't.
I'm going to send it to you.
Thank you.
If you don't understand why something is happening, where it's coming from, what the data is deriving from, the data is ultimately useless as pertains to meaningful impact, right? So that's what I thought of. Super, super bright, and you made it very, very simple for people like me. Thank you very much.
Absolutely, and I'm happy to come back. We have anywhere from 10 to 20 projects happening at once, so happy to come back and share more research and information if that's useful. Thank you.
Wonderful. Thank you. So at this time, we're going to move on to our the next part of our meeting here this morning. I want to introduce Kendria McWilliams. Some of you are familiar with her name and Maryville, but some of you may not be as familiar with her as you think you are. So Kendria McWilliams is the CEO for Maryville, Inc. She's my CEO. I have the privilege of being a director on the board of directors at Maryville. And we are a leading behavioral health provider. Actually, we're the oldest provider. Maryville is the oldest provider of addiction treatment services in the state of New Jersey, nonprofit provider. Kendria has extensive specialty healthcare experience, primarily in behavioral health, strategic planning, business operations, and management. Prior to joining Maryville as CEO in 2011, Kendria served as CEO of Eagleville Hospital in Pennsylvania. She also serves as board chair for the New Jersey Mental Health Institute and serves on the New Jersey Division of Mental Health and Addiction Services Provider Advisory Committee. She is the co-chair of the New Jersey Association of Addiction and Mental Health Agencies Addictions Practice Group, and as also co-chair with me, Southern New Jersey Development Council Healthcare Committee. Mrs. McWilliams also serves on the New Jersey Fee-for-Service Transition Oversight Board. That's a big deal in our space. Kendria received a number of awards. One was top CEO recognition from South Jersey Biz, the Andy Wagner Agency Director Award from United Way of Greater Philadelphia and Southern New Jersey, the Distinguished Service Award from the Maryville Board of Directors, and the Advocacy and Action Award from the Pennsylvania Hospital Association. Kendria received her BA from Ursinus College and an MBA from Westchester University. Kendria, welcome. Thank you. And I turn it over to you.
Thank you, Frank. So first slide, please. How are we doing with behavioral health treatment in New Jersey? Next slide, please. 67% of adults surveyed in the American Psychological Association's 2022 Stress in America poll state worsening of their mental health, lower physical activity, disturbed sleep, and increased use of alcohol and other substances due to COVID. 25% of the US worker line staff and almost 50% of the supervisory staff report feeling stressed almost all of the time. Worldwide, depression is the leading cause of disability, with the World Health Organization estimating 300 million plus people globally living with depression. Next slide, please. The CDC reports an estimated 100,000 plus drug overdose deaths in the United States during the last 12 months, ended April 21, an increase of 28.5% from the year before. And during that same period, it's interesting to note that almost double that number, an estimated over 140,000 Americans died as a result of excessive alcohol use. The CDC still reports alcohol, and this is a statistic that's been leading for a number of years, as the leading preventable cause of death. We need to advocate for our federal and state governments to put more resources into prevention and treatment, particularly for alcohol misuse. One of our council members recently asked if heroin really is the most life-threatening drug out there, and the answer is, in today's world, even a single Ativan or a single Adderall pill, if not obtained directly from a pharmacy, can kill us instantly if it's cut with fentanyl or another synthetic or veterinary medicine like a Tranquin. To reduce overdose deaths, we've flooded our communities with Narcan, which is a good thing. We're also using medications. Evidence supports this, but in the United States and here in New Jersey, we have not reduced overdoses or drug-related deaths. They're still climbing. Some providers prescribe Suboxone for opioid addiction and discharge the patient to the community with that medication or that prescription. And those people can end up in treatment, but as often as Mavis pointed out, they don't. There's co-occurring mental health, there's homelessness, lack of transportation, and unstable home life serving as obstacles for many people who are trying to achieve the first or sustained recovery. Insurance companies and other gatekeepers have significantly reduced inpatient stays for substance users. We're not winning the war against drugs with this strategy. We need to give people the care they need and shift our focus to a chronic care model, like we have people with heart disease, diabetes, and other chronic physical health conditions. Next slide, please. To improve outcomes, the approach needs to incorporate both treatment and community supports. Statistics show that people with substance use disorders often need 4 to 5 treatment episodes over an 8-year period to get to their first full year of sustained recovery. We've made a significant advance in New Jersey through establishing SAMHSA certified behavioral health community clinics, and they're referred to as CCBHCs. CCBHCs integrate mental, physical health, and substance use treatment to address the patient more holistically. There has been an increase in the number of behavioral health providers in the state. We now have a shocking number of 500 licensed providers, but Less than a dozen are CCBHCs here in New Jersey, in Southern Jersey in particular. Maryville, my institution, was recently awarded a SAMHSA contract to set up CCBHCs in both Vineland and Turnersville. Through CCBHCs, physicians, clinicians, and care managers provide the physical health screenings, the behavioral health treatment, the care coordination, and other services that people need to actually get to care and continue to care. In our case, we have about 100 partner hospitals, physician offices, mental health centers, and social service agencies. An important component for us, and I think for any CCBHC, is the core of certified peer recovery specialists, and they're called CPRS, that we have working with patients right in their home communities. We know the CPRS approach works. We have outcomes published on another SAMHSA grant we have, and this one is through Rowan University. Through that grant, we provide inpatient treatment and 6 months of follow-up care through in-community CPRS supports. Rutgers University is our research partner for that grant, and they found significant improvements in some really key areas with sustained recovery, obtaining stable housing and keeping stable housing, improved employment, improvement with following medication regimens, and reduced criminal justice involvement. Changes to regulatory standards and legislation are needed to support integrated care. Our licensing standards here in the state are very, very antiquated. They create inefficient use of physical and staff resources. Some examples, we're required to submit applications to the State Office of Certificate of Need and Licensing to add or change any service. But that state office doesn't have the manpower to review in a timely manner the 300 existing today provider licensing applications sitting in their queue. It can take providers a year, more than a year, to get approval to start a service. For example, to start much needed mental health services. Even after they have the staff, the policies, the protocols, the other requirements for licensing in place. There's been a severe shortage, as we all know, as our community needs assessments tell us, of children's services for years. And the COVID impact is compounding that need. But Perform Care, the state's managed care gatekeeper for children's behavioral services, has not been open, refuses to open to new providers for over 5 years. Technology is another issue. There's the reality of the fact that so many people don't have access to technology, they can't afford it. But from a provider perspective, acute care and community behavioral health electronic medical record systems can't communicate well with each other due to confidentiality and other regulatory and legislative types of concerns. And the state's information technology system is not interoperable with many of the provider systems. So technology deficits make integrated care much more difficult. Barriers which exacerbate the workforce shortage also impact access. There aren't enough licensed and credentialed clinicians in the state of New Jersey for every existing provider to be fully staffed. The state certification board must approve the licenses and certifications of every counselor and therapist before they work in any licensed setting. And that process can take many months. There are very rigid pre-employment and onboarding requirements for healthcare providers. Just getting a clinician registered in Medicaid or the managed care payment system can take months. And the state does continue to approve new providers and new programs. And that then exacerbates the workforce shortage. This reduces capacity and delays new service startups. We're not just competing with ourselves. We all here, we're competing with Amazon, Walmart, and CVS. And in our case, behavioral health employment for nurses, counselors, drivers, other essential staff. It's very, very difficult to compete with very large retailers. We need parity between physical medicine and behavioral health medicine. There's very little funding for research in genetics, research in new medications, research for relapse predictors, and evidence-based outcomes. We need payments that are adequate and payment systems that incentivize creativity, flexibility, and outcomes-based care. We're still largely dependent here in New Jersey on Medicaid fee-for-service and grants in the behavioral health world. And New Jersey's Medicaid reimbursement rates, sadly, are at the very, very bottom of the country's rates. The state is moving towards managed Medicaid. And when that happens, the behavioral health providers expect the costs and risks of doing business to rise substantially. You've all heard about the opioid settlement money that's going to be coming into the state. Half of those dollars will forevermore go directly to the state government, and the rest will be split up among the 21 counties for special projects. The opioid settlement money to date is not slated to go to existing safety net providers that serve as the backbone of the behavioral health system. And these are all key points for advocacy, not just for behavioral health providers, but for all business. We're all affected by mental health and substance use challenges in our workplaces. Next slide, please. So what can employers do? Well, increase options for where, when, and how people work. Working from home, job sharing, accommodating family social needs, flexible hours, opportunities for job growth outside of the traditional educational and promotional tracks. These are things we do to attract and retain employees. Re-examining health insurance policies, offer free clinical screenings, free workshops that address depression, stress management, substance use, and lifestyle coaching, offer health insurance at low cost or no cost of out-of-pocket for behavioral health treatment. Train managers to recognize signs and symptoms of stress and encourage employees to seek help. Listen to what employees need and use their feedback to evolve as a company. Give employees opportunities to participate in workplace improvements. Use surveys, town halls, suggestion boxes, focus groups, and communicate. When policy changes are made based on employee input, that's a big old win-win. Create a culture of acceptance. Encourage employees to be open-minded about the experiences and feelings of colleagues. Make it okay for employees to talk about their issues or even just sharing personal quirks that make them unique. Social inclusion in the workplace makes employees happy, foster a sense of social connectedness, and take a look at equity, diversion, and inclusion policies. That APA survey found that LGBTQ and other minorities are 3 times more likely to be looking to leave their employer. Reducing stigma associated with whatever makes us all different is important to people's well-being. Share positive experiences with employees and express happiness and gratitude. Employees do value positivity, optimism, supportive messages from leadership. And so, to me, it's important to regularly send encouraging emails, use meetings and social media to communicate empathy and support. So that is the conclusion of what I wanted to share with you today. I don't know if you have any questions or suggestions for me, but I do thank you for your time.
Thank you, Kendria. At this time, I'll open the floor to questions. Any questions?
Hi, it's Lydia. I'm here actually on Amy Mansou's behalf from Inspira. I have a quick question. You talked about the licensure standards for New Jersey being antiquated in the review of, licensing. In my experience recruiting physicians, we've always have been challenged with that. It takes 6 months to get a physician license in New Jersey. Is that unique to New Jersey, or is that because the physicians will tell me that that's not the case in other states?
Well, I don't have any personal experience out of New Jersey, except for in Pennsylvania. And my experience in Pennsylvania is over a decade old. But I do find the challenges that we face in New Jersey to be particularly thorny. And I don't remember, and I've not heard of my recent discussions with colleagues in Pennsylvania that they struggle with things. Certainly every state and every state licensing agency has its own consternations and difficulties. But these are ones that I think we really do need to try to have an impactful messaging and outcome and work with the state. One of the things that we've been trying to do through our advocacy efforts is develop an agreement, that an alliance between licensing and the providers would be most helpful for everyone. And that we could maybe come together to come up with some recommendations and improvements in some of the more impactful areas. So that's one of the things that I think would be helpful. But I agree, it's difficult.
Thank you.
Lydia, I'll just jump in. We do work with physicians in 24 states, and I can tell you that the licensing process in New Jersey for both behavioral health institutions and physicians is a problem that New Jersey is experiencing to the degree it is completely alone. It is not that way in most other states. So I'm not sure if that helps or hurts your
Well, it validates that, you know, we have an issue in New Jersey.
Yeah.
And if other states can accomplish it and provide safe care, why can't we do that?
That is a great question. We will connect after this call. Marcella, you had a question?
You're muted.
I did. Thank you, Kendria. And I didn't know you went to Ursinus. My husband graduated from Ursinus.
It's a wonderful place.
It was so cool. We just went for homecoming a couple of weeks
Yeah.
ago. It was beautiful.
That's good to know.
Yeah. So my question is kind of on a clinical side, but I'm just curious as to when mental health issues like anxiety and depression have persisted for, my understanding, many people beyond COVID who are not among the group who continue to suffer socioeconomic impact. But yet that anxiety and depression still remains. And I'm just curious on that. Then I'll ask a second question, which you could probably also answer. On the data that was presented about emergency department visits, on those heavy utilizers, I was just wondering about the composition of the need for those visits. I mean, I'm guessing that it's probably largely, mental health related, like acute mental health issues, but I'm just curious about that too, if you can answer that.
Is Mavis still on? Has she been able to stay on or not? Because it's her slide.
She's still on.
She's on, but she's muted and her video is turned off. So I'm
Okay.
not sure.
Well, I mean, certainly a great number of people in ERs experience comorbidities between physical and mental health. So you are right. It is not defined that a great number of people who are heavy utilizers do have significant behavioral health issues. Thank you. And yeah, I mean, we all, in terms of your first question, there are people who, I mean, most of us, the statistics tell us that most of us have had significant anxiety, stress, and depression at some point during our lives. It's a chronic, medications are great. Counseling, is useful at times. And it's with COVID, it just compounded everything. You're right.
Thank you.
One of the good things I think COVID did, and I think there's a long list of things that have had a positive impact, but one of the things is I think the light that has been shined on mental health and the help that has been to so many who have beat themselves up or really been harsh on other family members, but to come to realize that mental health struggles, battles are not odd. They're common, maybe different depths of them people experience, and maybe there's a few people that don't experience any, but I think the overwhelming majority of the population will at least at some point in their life encounter some mental health struggle. And the quicker you make peace with that and not judge yourself and allow yourself to process through there, the better off it'll be. And conversely, also then let that flow to employees as well. So, yeah.
Yeah, thanks, Frank.
Any other questions for Kendria?
Oh, and Lydia and Frank, I can support what Frank said about the approvals in New Jersey. Everything related to the healthcare system. We do planning and design work in many, many states. The majority of it in New Jersey, but both behavioral health and acute care, ambulatory, and New Jersey is by far the toughest. And with behavioral health, the trickiest because of the interpretations and lack of clarity and somewhat capricious approach to individual reviewers' perspectives.
Bingo. Bingo. Yes. So with that, I want to thank you all again for attending. I want to remind you that if you have not already put on your calendars, the save the date for December 16th for the SNJDC holiday luncheon from 11:30 to 1:30 at Seaview Hotel and Golf Club down in Galloway Township. Please mark your calendars. In fact, you could mark off the afternoon if you want and go to Smithville right after. It's a quaint little place if you've not been there. Fred and Ethel's is a great place to eat dinner, so you can make a day of it. But we certainly would love to see you at the holiday luncheon on Friday the 16th at Seaview. With that, Ben or Tom, do you have anything else for the good of the order?
The last thing I'll note is that we did record this meeting and we will distribute that to everyone in attendance and the full committee as well for those who were unable to join us, along with a copy of the presentations that you saw today, both from Mavis and from Kendria, with all the relevant links to the information that was referred to. Wonderful. Thank you all very, very much. Have a wonderful day. And if I don't see you, have a wonderful Thanksgiving.
You as well. Thank you.
Thank you.
Everybody, bye.
Bye-bye.
Thanks.